Look at Louise up there, and you see her liver, and out of her liver is kind of lying on, well, you can see the little green things, the gallbladder, and I guess that doesn't orient you too much. Well, you see the small tube below the liver. That's that duodenal or duodenal area, that beginning of the small intestine that comes out of the stomach. So you see the liver kind of lies over that. Now look at the big picture. You see the liver, which is kind of the reddish organ there. And then you see this sac. Well, you're good. You can move that. That is sac. That's the gallbladder. And then you see the greenish colored organ off to the left. That's the pancreas. And you see there's a duct going from the pancreas into the small intestine. And then you look up there and you see, you follow the liver down and you see there's a duct. It's called the common bile duct that goes from the liver into that same part of the small intestine, the duodenum. Okay, that duct from the liver, we're not going to talk about the pancreas at all. That duct from the liver is called the common bile duct. And what that is, it's a common bile duct. All kinds of little ducts that are in the liver, they coalesce, like a tree. The branches coalesce into a trunk. And they coalesce into a common bile duct, which carries the bile into the intestine. Bile, its primary job is to digest fat. So the more fat you eat, the more bile you make to digest that fat. Now, at the end of those ducts, right at where the duodenum is, there's a little sphincter that opens and closes. That sphincter's name is Odie. That's his name, Odie. That's what we would call him in anatomy class. And between meals, Odie is closed because you don't want bile squirting into your intestine when you don't have any food in there. So Odie's closed. And when Odie's closed, the bile backs up into that green sac, which is called the gallbladder. And when you eat, what happens is the gallbladder contracts and Odie opens up, and you squirt the body, the bile is squirted into the intestine onto the food and mixed up with the food to digest the fat. Okay, that's what those ducts do, and that's what the function of the gallbladder is. It's a storage sac for bile between meals. And let's go on to the next slide if we can. All right, there's your gallbladder. You see what it's filled with? It's filled with stones. Those stones are made of cholesterol. The hallmark of gallstone formation is supersaturation of the bile with cholesterol. Now, how do you think you get the bile supersaturated with cholesterol? Well, cholesterol is only found in animal foods. And gallstones are characteristic of people who eat the Western diet. There's some other infection-related gallstone issues, but they're not common for Westerners. Almost all Westerners who get gallstones, their gallstones are made of cholesterol. And how often do people get gallstones? Well, statistics are about 30 to 40% of women in their 40s and 50s have gallstones. But they don't hurt. They're just sitting there. There's an acronym that medical students learn to help give you a guess whether somebody has gallstones. It's, I guess it would be called the 4 F's. Female, fat, 40, fertile, and the 5th one they sometimes add is flatulent. Female, fat, 40, fertile, and flatulent. And you, in other words, they have bad GI distress. That's what flatulence refers to. So that's an acronym every medical school student knows. Now knew when I was a student, and probably knew 100 years before. Female, fat, 40, fertile, and flatulent. Okay, so you get supersaturation of bile with cholesterol because it's supersaturated. It coalesces into stones, and now you have gallstones. And they just sit there, and they're no trouble at all. As I told you, maybe 40% of women in middle age have gallstones, and they don't even know about it. They're asymptomatic. And you might find it, say, with a chest x-ray, or they're looking around with a sonogram or something. They may find these gallstones that aren't bothering you. And there's a chance the doctor may say, we got to take those out. they could turn into cancer. You know, ladies and gentlemen, the chances of them turning into cancer is about 1 in 10 million. It's really unlikely. They'll also tell you, well, those gallstones, they could block up the cystic duct, which is the little duct before the common duct. It's the duct that goes between the gallbladder, that little tiny 1-inch duct there. That's called the cystic duct. That a gallstone could get trapped in there, and then you could have a gallbladder attack. And that is true. And that could be a problem. The gallstones, they sometimes will pass completely. Of course they do. They pass completely. But sometimes they get stuck, and then you're in horrible pain. You could become jaundiced. Yeah, you can die. I mean, you can get really sick. So the doctor will scare you into having your gallbladder out with that threat that you could get a gallbladder attack later to a lodged gallstone. But ladies and gentlemen, there have been probably a dozen studies done looking at what the chances are of you being helped versus harmed by taking those gallstones that don't hurt you, or asymptomatic gallstones, out. So they set up studies where they take a group of people and they take their stones out immediately. They take the gallbladder out. You can't just take the stones out. You have to take the whole gallbladder. And so they take the gallbladder out and they compare them with a group that they left the stones, the gallbladder in. And they compare the chance of dying and being hurt over the next many years. Well, in each and every study, and this is a big argument, especially for those people whose business is to take out gallstones. There's been a big argument whether we should take out those gallstones that don't hurt. And the studies say, don't do that. That you're at greater risk of being harmed, like with the surgery, and people die from that surgery. They sometimes get their common bile duct cut, and boy, is that a disaster. You're more likely to be harmed by immediately having those stones that don't hurt taken out than leaving them alone until someday they might hurt. And that doesn't very often happen. Most of the time you die with your gallstones, and then if you donate your body to the medical school, the medical students, they have something to play with during their autopsy class, during their anatomy class. You know, oh, hello, look at my cadaver. Look at all these stones in the gallbladder. So leave for the students. Anyway, that's kind of the way it is. Now, I want to add one other thing here. Again, I've been around a half a century doing this. I'm not half a century old. I'm 70 years old, just about. But I've been in medicine for a half a century. And the way we used to take gallbladders out is we would take and make a big incision, a 9-inch incision right under the right rib cage. And that's a big deal, really hurt. I mean, really, people tell me that incision is the most painful incision of any place in the body. I've been told that. Well, that's how we did it. And then we got the development of these scopes, laparoscopes with instruments with little scissors on them and stuff. And we started removing these gallbladders through laparoscopic surgery, where we put a couple of holes, little 1-inch, half-inch holes in the abdomen, and you go in there with these scopes, where you look and you cut and so on, and you take the gallbladder out with this rather non-invasive procedure. You know, when that technology was introduced, the incidence of gallbladder surgery went up 400%. 4 times more gallbladder surgery occurred with the introduction of that instrumentation. Why? Because patients said, well, it's no big deal. And doctors made a heck of a lot of money doing it. So that was kind of interesting as to the change in the incidence of gallbladder surgery after the introduction of the simple technique. Anyway, so leave your gallstones alone if they don't hurt. Now, if they do hurt, the time-honored treatment for gallstones is a low-fat diet, and then the pain goes away. And then you die with your gallstones. But if the pain doesn't go away, maybe the only thing you can do is have the gallbladder out. And now you don't got a gallbladder. So where does the bile get stored? It doesn't. It comes out of that common bile duct. It goes to OD. OD has to open up. And so that bile constantly drips into your small intestine, and there's no food in there to mix up with it. And so you get chronic irritation of your intestinal tract from this bile that should have been stored in the gallbladder, but can't be because the gallbladder is gone now. And now from that chronic irritation, you get diarrhea. about half the people who have their gallbladders out, still have troubles. And a lot of them, the biggest trouble is chronic diarrhea, because the bile acid gets into the large intestine, irritates the intestine, and they're in the bathroom on the toilet 20 times a day with watery stools. Anyway, you can fix that. Because remember, I told you bile is made as a consequence of eating fat. So if you don't eat fat, the liver doesn't make much bile acid. And when you eat plant foods, it has a whole bunch of fibers and other plant parts that mix up and activate that bile. And I take care of people who have chronic diarrhea. I take care of people secondary to removal of gallbladder or other problems that they have in their intestine. I take care of people who literally live in the bathroom. They've got their computer terminal in there. They've got their telephones in there. They're having 20 watery stools or more a day. I have people that tell me they haven't been able to go to a business meeting in 2 years. They haven't basically been able to leave the house. They can't go on an airplane because of this chronic irritation of their large intestine from the bile. Now, what I tell them is I say, just change your diet, it'll be gone in 3 days. And they get mad at me. Why are you treating my serious problem so lightly? Because it will. It was shown by Andreessen in the journal Gut in the 1970s. He took people with ileopathies that had 20 watery stools a day, and he put them on low fat. This is in the 1970s in the journal Gut. And every medical student should know this, and every doctor should know this, and they don't. And what he found is that within 2 or 3 days, they were having 1 or 2 formed stools a day. And just think of all the suffering patients out there that don't know this because you can't package it in a drug and sell it to somebody at CVS pharmacy. It's just simply changing the diet. So it's, I can't tell you how happy I've made many people who have this chronic diarrhea.